Study between Intermountain Medical Center and Johns Hopkins University could prove the best practices for stroke treatment. Today marks our last report in our stroke awareness series with Intermountain Medical Center. The new study looks at medical therapy versus minimally invasive surgical therapy to treat hemorrhagic strokes.
People told me I had a stroke, and I go, no, I didn't. And finally, I realized I did have a stroke.
This is the hemorrhagic stroke inside Beverly Barnes's brain. The white area is the blood that started leaking out.
I got up that morning and I had a headache. It felt like my head was going to explode.
At the hospital, Beverly's blood pressure was off the charts, her cognitive skills weakening. So Beverly went through a CT scan like this one, and that's how doctors got this image and found out what they were dealing with. And they had options for treatment like medical therapies.
Control the blood pressure, because uncontrolled high blood pressure can cause the hemorrhage to worsen. The second is to correct any abnormality of blood thinning.
Or cut open her skull and go inside to remove the clot. A massive surgery and even harder recovery. But Beverly's husband Jerry opted for a clinical trial, a research study between Intermountain Medical Center and Johns Hopkins University.
And this test they did, we're going to save people in the future all the pain and the infection and the time recovering. So we signed her up on this test, and thank God that we did, because she's here today.
The clinical trial that Beverly was enrolled in is a trial to look at minimally invasive surgical therapy versus medical therapy.
Take a look at the CT scan showing the procedure.
So this is the hemorrhage right here, and this is the catheter, and this is the minimally invasive surgery defect in the skull.
That defect or hole in her skull is about the size of the tip of a pencil.
Right at the time that the catheter is placed, a syringe is used to suck out as much of the hematoma as can be removed.
Then blood thinners injected through the catheter for 3 days, and it worked.
If there's angels anywhere, they're right here in this hospital.
Beverly still has more rehab and appointments, but she's out of a medically induced coma and recovering.
I tend to get tired a lot easier. I was having like little headaches every once in a while, but I'm not having the little headaches now. They're gone. The only thing is my legs aren't as strong as they should be.
I think that Beverly is going to do great.
Now, we won't have the results from this new study for a few more years now. At that point, we'll know if medical therapy is best to treat hemorrhagic stroke or if the minimally invasive surgery Beverly had is the best practice. If you want to watch all 5 of our stroke awareness series, just go to our goodforutah.com website.